Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson with MedAxiom HeartTalk, and today we are talking about population health and how technology is playing a crucial role in innovating cardiovascular care with Chanel Swartz, Vice President of Value-Based Care Operations at US Heart and Vascular, to talk a little more about this very important topic. So thanks for joining us today.
Thanks for having me, Melanie.
All right, so Chanel, my first question. You have spent much of your career advancing value-based care and population health. So what first drew you into the space, and how has that shaped the way that you think about innovation in cardiovascular care?
Yeah, so of my nearly 2 decades in healthcare, I've been able to spend a lot of it doing value-based care or team-based care, whether it's been in the oncology environment or the primary care environment. And what's really interesting right now for value-based care is specialties are primed, especially specialties that have a lot of high spend in them to optimize taking care of those patients better, which is what's interesting about cardiovascular care. These patients with these chronic cardiovascular conditions often have social determinants of health that are impacting how they are cared for, that maybe a traditional fee-for-service payment mechanism wouldn't work for. And so when you think of population health for the cardiovascular space, you've got these chronic conditions like heart failure, AFib, hypertension that really lend itself to leveraging technology to understand better what's going on with those patients. Leveraging things like remote patient monitoring for them to be able to take like their daily vital signs and impact how the clinicians are able to see what's going on with their patients and do intervention early.
Mm-hmm. And it's always being monitored, so you don't miss a beat.
That's right. Don't miss a beat.
Don't miss a beat. All right, exactly. Literally. All right. So when it comes to remote monitoring, what role has technology? You kind of started to talk about that. Really played into enabling your teams to scale and improve outcomes.
Yes. For US Heart and Vascular, we've spent this last year getting everyone on to one electronic health record, one PACS system, one CIED monitoring system, and then we did launch remote patient monitoring services across the platform. And so being able to leverage technology that way and have all that data come in. When you think of population health, you need a lot of data points to really be able to understand what's happening with your patients. And by leveraging and streamlining all those different technology platforms has poised us really to be able to do population health and value-based care very well across the platform. And so, for example, the remote patient monitoring that we launched this year, it's an internal team of nurses and medical assistants that are monitoring alerts all day long and escalating things appropriately to their primary cardiologist if needed, or proactively just managing patients' disease states. You know, you think about your goal in population health is really great outcomes for the patient and decreasing cost of care needlessly. And so being able to leverage that technology allows us to just have much better care wrapped around the patient.
And it allows other players to be involved in that care.
Absolutely.
More appropriate people as well, because they can raise the red flag or even, as you mentioned, just kind of handle it on their own.
Yeah.
Do you have an example, maybe a specific example of how this worked very successfully?
Yeah, so when you think of a patient who you've got, Betty Smith at home every day who's taking her blood pressure, and the centralized team is getting alerts of, gosh, we've noticed Betty's blood pressure has been slowly increasing each day, and she's not really due back for an appointment in 6 months. So being able to monitor that allows the team to be, in real time, reach out to the patient, understand what's going on, triage the situation, bring them in for a visit if need be, or just connect with the primary cardiologist to be able to titrate a medication appropriately. And by being able to do that, we've likely avoided a hospital admission or at least a trip to the emergency room for the patient.
Yeah, because Betty Smith usually would be writing in her journal and may miss a day.
Or not even taking her blood pressure, right? And just waiting for that 6-month follow-up.
Which is
and by the time she's come in, if she even made it to there, has had a worsening of her chronic
Right,
condition.
yeah, no doubt. So managing large cardiovascular populations, it's complex. You hinted towards that earlier. But what kinds of workflow or technology shifts have you noticed to be most helpful in overcoming these operational challenges?
Yeah, I mean, that's part of the beauty of people joining US Heart and Vascular is we are a physician practice management platform, and it allows us to be able to scale operationally things across many markets. So we've got this centralized team that really is just an extension of the primary cardiology team that's already happening. So you've got this team of nurses, nurse practitioners, medical assistants, social workers who have, standard protocolized workflows that are focused on cardiovascular conditions. We've got escalation protocols that allow us to engage local care teams. We are able to leverage, since we're all on one EMR, everything's getting stored in there. We're able to store all of our assessments in there, all of our conversations with the patient, whether we're leveraging, telephonically or using things like a patient portal to be engaged with them. We can send them HIPAA compliant text through our portal saying, hey, it looks like you haven't taken your blood pressure today. Remember to take your blood pressure. And so just really making sure all those operational workflows are there. I think the other key thing too is you got to kind of keep it simple for the patient, and you've got to meet the patient where they are. Yeah. And so when you're leveraging like remote monitoring devices, your patient may have different aspects of digital literacy you've got to meet them at. We want to make sure that we pick devices that were easy for the patient to use, that just got shipped directly to their house, and so leveraging those types of workflows. And I think you could have a lot of clinician burden with all this data, all these alerts. And so making sure your workflows really only escalate to the care team what needs to get escalated, and you're actually trying to deburden what's happening in the clinics so that the clinician and the clinical team that's there can focus on the patient that's in front of them.
Yeah, I love that. My mom has remote monitoring, so all this rings so clear to me because, I was like, how do they know what's happening? How do they even have, if something does happen, will they make that phone call? And then I get the text messages instead of my mom, so that I can pick the phone up and call her because I know I'm better and faster at that. Looking ahead, what do you think are the most important elements, clinical, operational, or technological, to really get right in remote patient monitoring and population health if we want to create a lasting impact?
Yeah, I think you've got to think for the future state of population health and value-based care, it's got to think of the outcome in mind. And so when you're thinking of the clinical component, these need to be tailored to cardiovascular condition protocols, whether it's AFib, heart failure, hypertension. You need the workflows to be not burdensome for the in-clinic team. They need to be able to refer patients to programs easily. They need to be able to drive patients to the right side of care easily, but they also need to get the information back in a way that allows the clinician to make real-time decisions with whether it's point-of-care alerts, whether it's them seeing trended data in a way that they can easily bring into their note and then titrate a patient's medication. And then the technology's got to be right. So having things as integrated as possible. We have a very, fragmented healthcare system. So however we can coordinate care with greater ease, pick more appropriate interventions earlier with greater ease for our patients. The whole idea is we're trying to help them achieve optimal outcomes for their chronic condition. We're trying to improve their quality of life, whether it's for the patient, whether it's for the clinical team. Think of the quadruple aim, right? In terms of that's really what value-based care is doing, is the quadruple aim. High quality care, low cost to low financial burden to the system, a great patient experience, and a great experience for the clinician and the care team.
Yeah. If you could look forward maybe 3-5 years, what do you see? I mean, technology's changing so fast.
It is. I think we're going to have even more points of data. I think there's going to be even more interesting ways of monitoring. I hear from vendors all the time. There's going to be ways that we're able to monitor that don't require a patient to necessarily have to wear a blood pressure cuff. There are devices out there. There's systems you can put in places that you could tell if a patient how long they slept in their bed at night, how often is a heart failure patient sleeping in their chair because they can't lay flat. So there's going to be a lot of interesting ways to monitor a patient in their home. It's better for patient outcomes to be home more than it is to be in the hospital. It's lower cost of care and financial burden to the system. And so I think we're going to see a lot of innovation in this space.
And quickly too,
Yes.
I'm sure.
Yes.
All right, Chanel, thank you so much for joining us on this Heart Talk.